So I now have the pleasure of inviting and introducing our newest member of ONC to the stage, Lana Moriarty. This is only her second week on the job, and I've promised her that this is a really nice audience and that it would be just fine for her to get up after being here for only 5 days. Lana is the acting director of the Office of Consumer Health, and Lygia has turned over the reins to another star. Lana comes to ONC from HHS's Health Resources and Services Administration, where she managed part of the National Health Service Corps and the Nurse Corps programs. Prior to joining HRSA, Ms. Moriarty was with the World Bank Group, where she worked as a gender specialist to ensure the needs of women and girls were included in the bank's many overseas development operations. We're excited to have her as part of the ONC family, and please join me in welcoming Lana Moriarty.
Thank you. Okay, can you hear me? Yes. Good. Okay, I'm mic'd in many different ways, so thank you all. I'm really thrilled to be here at this and take this opportunity to meet all of you. As Jody said, it's day 5, so be kind. But I throughout my career, providing access to healthcare has been a really important thread. And so I'm so happy to be part of the ONC family, to celebrate their accomplishments today, and to meet all of you. I really feel like there's a lot of collaboration. I want to hear your perspectives. I want to hear the initiatives that are going on across the country to move the consumer engagement work forward. So I know that we have an exciting agenda, and I'm delighted to welcome to the stage Barbara Sorensen and Alexis Berries. I hope I pronounced your name right. Thank you. Barbara is the Chief Executive Officer for Altruit. Altruit purchased Health Shack in 2012. And Alexis is not only a patient with us today, but our youth ambassador from Health Shack. So please welcome them. I had the pleasure of talking with them over the phone, and I really think this is an amazing initiative. And so I wanted to just start our conversation by asking Barbara to just tell us what is Health Shack and how did you come about working with this population?
Great, thank you. Well, thank you for having us. We appreciate being here, and we're very excited to be able to share Health Shack with everyone in the room. Health Shack is a personal health record, so to speak, that is a web-based application kind of targeted towards homeless youth and youth that are transitioning from foster care into adulthood, so young adults. And what's unique about it is it was designed by youth, for youth, and the youth actually control who gets access to the actual application itself.
And how did you sort of get such a challenged population as foster youth in transition and homeless to be interested in this initiative?
That's a great question. It's a challenge daily. As everyone knows, most youth, I have a 17-year-old grandson that is far more interested in going and playing soccer as opposed to taking care of his health as well as his education and other things. So we utilize a lot of different things. The ambassador program, which Alexis is very much involved in, really is at the forefront of it. And we recruit actual youth that are in the community, in the various organizations, whether it be in a structured program within a foster care agency or at a homeless shelter. And we actually bring them on as an employee and have them work as an advocate with those particular youth. So. Okay.
And I think one question that many of us in the room would have is how do these youth really gain access to the internet in order to utilize Health Shack and its benefits, and where do they get access?
Sure, that's a great question as well. I mean, nowadays you'd be amazed with the amount of youth that are out there that are homeless that actually have smartphones. So what's really good about Health Shack is it is web-based. Our mobile application version of it is still being developed, but they can still access it via their actual mobile device, as well as any public location that has any libraries, etc. And we primarily work a lot with the community-based organizations in some structured environments with the programs, and they typically have systems that are set up there for them to be able to log right in and work with their particular workers.
What about issues of privacy and security? How do you tackle those in your marketing and outreach to these youth?
The security is a big issue with the youth that we're serving. Most of these youth, as I indicated, they're either homeless, they've been in foster care all their lives, so the trust issue is huge for them. And because of that, we have intentionally structured it so that the youth actually have to have someone present to educate them to actually log into the system and create the account. And that way we can talk through what it is like to be able to share your password with other folks and the risk that's associated with that as well. Some of the organizations we work with even go as far as having something printed that they come up with locally, and they go over that very thoroughly with the youth to ensure that they have in fact understood that the information that they're actually putting on this record, which by the way is not just a health record, it also takes into account their homes where they've actually lived, their employment, where they're going to school. It generates resumes for them. So there's a lot of other components that are there, but critical that they understand, what's at risk for them if they do in fact start sharing those passwords with other people.
Alexis, I want to hear a little bit from you. How did you even find out about Health Shack?
So I was referred to Health Shack through my county social worker for the Youth Ambassador program that we currently conduct.
And I know that it pulls together a lot of different information, sort of housing information, accessing your resume, and including your health record. How do you feel that having electronic access to your own health records has helped you, and what has it meant in your life?
So Health Shack has empowered me to take control of my own life records. I've been in foster care since I was 2 years old, and I've been faced with many different challenges. Now that I'm transitional age youth, meaning I'm of age to transition out of foster care, the biggest challenge that I have is taking control of my own records, and Health Shack empowers me to do so. I have severe asthma, so it allows me to track my dosage, my medicines, visits, and things like that. And the best part is it's accessible, and I can access it anywhere that I'm at.
And how often then do you find yourself using Health Shack?
I personally can use Health Shack 3 to 4 times a day, depending on how many times I need or I take my breathing treatment. And what that does, it also tells me, okay, if I'm doing it too much, maybe I need to go into a structured facility or a hospital or things like that. But we have youth that use it maybe once a day, maybe once a week. It all depends on how they need it and what they need it for.
And I really I know that you all were talking about the focus is really on holistic health. So the idea is that if we make it easier to find housing opportunities, to get a job, all of those will improve health outcomes. So I really like that aspect of it. So what about being a youth ambassador? What does that mean, and how do you go about recruiting and counseling your peers?
So what is a youth ambassador? A youth ambassador is a youth like myself who goes out and does outreach and education, who has those skills, but if they don't have them, we help them build those skills to do so. A youth ambassador job duties because they get paid could be anything from blogging to going out and doing presentations like what I'm doing. Being a youth ambassador has actually given me the confidence that I've lacked growing up all my life. So it also just really empowers me to be able to do and be healthy and living every day as well, just tracking my records.
Thank you. So this program is only in California right now, is that correct?
We're currently in California. We have about 9 or 10 different organizations and locations that we're working with in California. We most recently are moving towards Allegheny County in Pennsylvania. So we will be probably in October expanding into that county. We'd like to, go everywhere, and that's, Alexis was a little, I think, undermining of the Youth Ambassador program. We're extremely proud of that, and that is just critical to our entire program in keeping the youth involved and engaged in not only being able to come out and do speaking as she's doing today, but also in being able to help us with better, improvements in the application. So we have work groups where they come in and we talk through what are the things that you need in order for you to be engaging in this, because the engagement piece is the hard part. Getting them in initially, everyone will, sign up, but coming back. So lots of things we have planned to help them out with that.
And how many youth do you have in the program now, just to give a perspective to the audience, and then how many youth ambassadors are helping you recruit others?
We have about 700 to 1,000 different youth that are currently enrolled. The youth can only, as I indicated earlier, they can only enroll if in fact they're attached or belong or somehow connected to an actual organization itself. Like I said, we have probably about 7 to 10 of those organizations currently that we're working with as well. So,
okay. And then I think my last question is just, what is your biggest challenge going forward?
Well, that's pretty easy. The biggest challenge that we have really is on the fiscal piece. We are a small organization. There's about 10 of us on staff. We have web developers and programmers and ambassadors, and I think I forgot to mention we have about 4 or 5 ambassadors currently that we do hire on as employees and provide job skills to them. The challenge is really with the organizations we work with. They all are nonprofit. Many are homeless shelters. So the funding that's available to these particular organizations is limited. So we're constantly, in that mode of, is there an RFP, is there a grant, where can we be written in order to substantiate the cost? Because there is, obviously a cost associated with being able to house the data and ensure that, it's HIPAA compliant, et cetera. So that's a real easy question. Yeah, and the hard one.
Yeah. Good. Well, I know this is Alexa's first time in the nation's capital, first time on an airplane, so I want to thank them for coming all the way from California.
Nice job, Alexis.
And I just want you to encourage you all to find Alexis and Barbara and hear more about Health Check firsthand, and let's see if we can replicate it in other parts of the U.S. I think they're already moving into Pennsylvania, so it has very ripe opportunity. We are now going to go to break for 10 minutes, so if everybody can come back 10 minutes from now, and we will start with the next panel. Thank you.